Hatvet PHARMA welcomes you to the ocean of practical knowledge about small animal practice, that is, Hatvet's YouTube channel. We are thankful to our honorable speaker and session moderators for sharing their valuable time and knowledge with us.
Welcome to our webinar. It's a very important topic, parvoviral enteritis. Since we know that it is a very dangerous disease and very commonly affect our pets, it's a big agony to our pet parents. We all know the importance of parvoviral enteritis. It affects mostly young pups and are having a high mortality rate. And so, it is very important. As we all know, when we go with the clinical trials, management, etc., in parvoviral enteritis, it is very difficult to manage, especially in puppies below 3 or 4 months of age. It will be very difficult. Whatever we do can end in mortality. So, we always emphasize on prevention is better than cure. So, here also, I start with the godly word. Prevention is always better than a cure. So, let us come to the topic canine parvoviral enteritis. Yeah, I don't want to go into the history and all in deep into it because all our doctors sitting and viewing this webinar, but I have to tell some capsule information like this disease, this dreaded disease emerged during 1977-78, and this was fast spreading like in the case of feline panleukopenia. It almost looked like feline panleukopenia. We can say that it is feline parvo. The feline parvo, panleukopenia is feline parvo. And this virus survived outside the house for almost 6 months. That also we know. That's why we say when there is a parvo case in a house, this parvovirus will be sticking to the utensils, the clothes, the walls, the premises, the surfaces, crevices, pillars, everywhere, mats, everywhere. So everything should be disinfected. We used to tell them, you put bleaching powder over it. So this parvoviral enteritis producing viruses, the parvovirus, will be eventually destroyed by oxidation. And of course, we know that it is a very sensitive virus as well as a very resistant virus. A resistant virus. Why we say resistant virus? It can resist ordinary heat. It can resist most of the disinfectants or antiseptics. It can fly through the atmosphere almost 80 miles. 80 miles. 80 miles is not a small distance through the air. That is why it is said that it is a highly contaminating disease. And it is fast spreading. And it is so species specific. We have the canine parvovirus, the mink parvovirus, we have the human parvovirus, and so all these are not antigenically related but have some similarities. That is why they are coming under this family. The virus as it is a very small virus and can be termed as the smallest virus. It's a naked virus, like the rabies virus. It doesn't have an envelope. As we know, the rabies virus has an envelope, a protein, lipoprotein covering. and this envelope can be destroyed, like what is happening in rabies virus. The antibodies will come and destroy this envelope, and so it will become a nude virus like Karna in Mahabharata. Karna was born with armors and everything, so he was protected by all these things. But this was then relieved and given to the dad of Arjuna, Devendra, and by that time he became nude without this arms and aprons. Like that, the virus will be destroyed when there is no envelope, but this is a naked virus itself, and also at the same time very resistant. It's a single stranded DNA virus. Those things happen. I'm not going deep into all those things. It produces two symptoms, especially in young ones: the acute myocarditis and hemorrhagic enteritis. We are commonly seeing this hemorrhagic enteritis, but the acute myocarditis is generally seen in very small pups, like 2 months or 1 month or newborn puppies. So we may not be able to distinguish whether a myocarditis has happened. Before that, it will succumb. And this can happen at any age. We all might have seen this parvovirus. I have seen in different ages as a small pups, middle-aged pups, senior pups, adults, geriatric patients and all. So when it happens in animals which is more than 1 year of age, that is adult, the symptoms may not be that much severe. And in that cases, symptoms will be mild and sometimes even asymptomatic. In severe clinical diseases, it will happen only in very young animals like 2 to 6 months of age. And Rottweilers and Dobermans are highly susceptible to. See, Rottweiler itself is a far relative of Doberman. It is a super relative of Doberman. And so, in Rottweilers and Dobermans, they are highly sensitive to parvovirus infection. Protection, as we know, there is a transcholesterol protection. See, we know about the vaccinations. We have active immunity and we have passive immunity. Active immunity, by active immunity, we are injecting the virus itself, that is a vaccination, and we are producing antibodies, that is active immunization. Passive immunization means it is the antibodies which are passed from the mother's blood through the uterine villi into the fetal circulation. So that is a passive immunity. That is, here it is through colostrum. Through colostrum, the maternal antibodies will enter the infants or the puppies as when they suck the colostrum. See, when it is born, it won't be having any antibodies at all. There is transcolostral the transmission of antibodies. And so when the pups are born and they started drinking milk or suckling milk, through the colostrum, these antibodies will be entering, and this can protect the pups up to almost 2 months of age. Maximum is 1.5 to 2 months of age. That is why we always say that our pups should not be vaccinated until it comes to 1.5 months. That is 6 weeks of age. Because during that 6 weeks, that maternal immunity is there. If the dam is properly protected, that is another clause. See, if the pup is from a reputed kennel, see, for example, just now, today, a Siberian Husky pup, which was the 32 days age, was presented to me. Somebody told that the vaccination against parvo has to be taken in small pup. And he purchased this puppy for 45,000 rupees. And it is a pure, genuinely pure puppy from a reputed kennel. And I said that, beta, this puppy need not be taken any vaccination right now because it is only 32 days of age. During this time, it is having that passive immunity. Let that passive immunity stop by 6 weeks of age, that's 45 days of age. He said, no, 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 that breeder told that immediately vaccinate because parvo is endemic here. Okay, parvo is endemic here. See, owing up to that breeder, I will speak to him. The breeder is a very genuine person and he only advised because he is very much worried about parvo. And I taught the breeder, did you, first of all, I asked, did you vaccinate your bitches properly? Yes, doctor, everything is protected. Absolutely. Then, gentlemen, never fear of this because your puppies will be having passive immunity because it has suckled the colostrum, and during this suckling, it might have acquired the passive immunity, and this lasts for almost 1.5 to 2 months. And another thing is factor is that the immune system will full-fledgedly work only by 45th day. So now if you give the vaccinations, I am ready to give the vaccine, but it is unethical. If I am giving the shooting the vaccination, it will just be as if I am simply shooting some 1 ml of distilled water. Because there is no active immune system right now because it's a very small pup. The immune system is not that much well developed to make an active immunity. See, this antigen what we are injecting, it should go inside, it should produce an immune response. When there is a full-fledged immune system, it should produce an immune response and antibodies should be produced. And generally we say that antibodies against this parvo and distemper, the required antibody titer will be produced in 48 hours. For that, a proper working immune system should be there. But it is a very small pup. So due to these two reasons, it is better not to take any vaccine now. Otherwise, if we take a vaccine right now, already the preformed antibodies are there, I'm injecting the antigen, this antigen clumps with the antibodies and the action of these antibodies will be nullified. It will become a nude pup, becoming sensitive against parvoviral enteritis. I advised him, I convinced him, and I convinced the boys also. These are the problems. There is no problem with me. See, because while vaccinating, I am using a vaccine and I am getting the money. I am charging good amount, 1,500 rupees for your parvoviral vaccination. So I'll get the money. Why should I fear of all these things? But I am educated. We are all veterinarians. We have a medical ethics and we have to educate. That's why we say in our oath itself, being admitted to the profession of veterinary medicine, I solemnly swear to use my scientific knowledge for the benefit of the society through the protection of animal health, the relief of animal sufferings, the conservation of livestock resources, and the advancement of veterinary medical knowledge. Then the second paragraph, I will practice my profession conscientiously with dignity and in keeping the principles of veterinary medical ethics. That's very important. That is why I advise the honor like this. Then the third paragraph, I accept as a lifelong obligation the continual improvement of my professional knowledge and competence. This is the third one. See, everybody knows. So we have a medical ethics. According to the ethics, I taught them and they were very satisfied and they went away. So that is the maternal antibodies and the passive immunity. And we can go on with regular vaccination. And always I advise my pet parents not to take out the pup until it is fully vaccinated. What is a full vaccination? The first vaccination at 6 weeks, the first booster at again 9 weeks, the second booster at 12 weeks. That is a full vaccination. Even we can take a fourth vaccination at 15 weeks. How many times we are vaccinating the pup in a gap of 3 weeks? That gives maximum immunity. So generally I used to put 3 vaccinations 3 weeks apart. 6th week 9th week and 12th week. So until we complete all the vaccinations, advise our pet parent not to take out the pet and not allow to, especially to children or the pet lovers or anybody who are pampering other pets, come and take out this small pup, because they may unknowingly transmit the disease. And so don't allow them. Then coming to the pathogenesis, I'm not going into it deeply the pathology. I know I can take almost half an hour to or 1 hour for the pathogenesis itself. But simply we can go through some factors like the primary multiplication is in the tonsils, secondary multiplication is in lymphocytes in the next 3 to 4 days, and there will be cell lysis producing viremia. Then at last it will localize in the bone marrow and the gastrointestinal tract. In the bone marrow, since it is localizing in the bone marrow, producing bone marrow suppression to produce anemia as well as thrombocytopenia, DIC, etc. And also, since it is localizing in the gastrointestinal tract, produces all these gastrointestinal symptoms like vomiting, diarrhea, prostration, all those things. And cause of death. Cause of death is, we know what is the cause of death in parvoviral enteritis. It is diarrhea and vomiting only. And due to diarrhea and vomiting, there will be extreme dehydration, hypokalemia, hypoglycemia, circulatory collapse, shock, etc. So these are all sufficient causes for the death. Then there will be loss of an intestinal barrier. We know there is a flora in the barrier. There will be bacterial invasion, there will be septic shock, septicemia and death. There can be even multi-organ failures like kidney failure, hepatic failure, etc. Acute myocarditis and cardiac arrest also can happen in small puppies below 3 months of age. Regarding the clinical signs, as we all have studied in the theory classes, there will be a fever, but fever is not a must in all cases. I have seen several cases that there was no fever at all. Instead, there was a hypothermia. But the owner might have gone unnoticed this fever. Anyway, the owner himself says that there was no fever at all. There was no rise in temperature and all the extremities, the body, everything is cold to touch. There is hypothermia. But fever should be, because during the viremic phase, during the multiplication of the virus, there should be a fever. That is an immune response. There should be a fever and becomes lethargic due to vomiting and diarrhea. There will be dehydration. She won't be eating anything at all, especially puppies. If they are not, we know the frequency of feeding in the puppies. If it's a 3 months old puppy, we have to feed at least 5 times a day. So if it is not eating anything, severe dehydration occurs, hypoglycemia occurs, hypokalemia occurs. They becomes dull and depressed and lethargic. There will be congested mucous membrane. Typically, the mucous membrane will be congested. That is very usually happening. Congested mucous membranes, and they won't walk or play. They will be always sitting idle. That's a clear-cut sign. At first, there won't be any classical clinical sign like vomiting or diarrhea. Immediately, vomiting starts, and the first sign of parvoviral enteritis can be retching and vomiting. When a pup is retching, vomiting, prostrated, dehydrated, immediately the first thing we have to suspect is parvoviral enteritis. We have to inquire whether the vaccination has been completed, or if it is a very small pup, we have to inquire whether the dam is vaccinated. Sometimes we cannot trace it. So there will be severe dehydration, then retching and vomiting. Retching and vomiting produces more severe dehydration. Then there will be diarrhea. First, there will be watery diarrhea. That is very important. Whenever our doctors, our clients think that the parvo should be having immediately bloody diarrhea. No. In all the cases of parvoviral enteritis, there should be watery diarrhea followed by blood mixed diarrhea. Then first there will be watery diarrhea, and this watery diarrhea itself will be rotten and smelling. We having an offensive fetid odor because of due to necrotic enteritis, peeling of the enteric mucosa, and necrosis of the enteric mucosa. So it will be first watery diarrhea, then blood mixed diarrhea, and then during that time itself there will be an offensive fetid odor diarrhea. Then there will be hemorrhagic gastroenteritis. The intestinal villi will become blunted and unable to absorb nutrients. Nothing will be eaten. It won't drink any water, it won't eat any food because nothing will happen. All the alimentary canal right from the mouth up to the anus will be damaged. So how can it eat? And also the complete mucosa is damaged and the flora is gone, totally distracted. Everything is गड़बड़ हो गया. मतलब पूरा तो गड़बड़ हो गया, पूरा इंडस्ट्रियल गड़बड़ हो गया. So that is the thing which is happening. And the GI flora is completely destroyed. That is why we always mention that in every case of parvo, when it starts eating, immediately start with some probiotic materials which provide some bacteria. So the intestinal barrier is completely broken down. The intestinal crypts will be completely collapsed. Those can be seen in histopathological sections. And the Peyer's patches. What Peyer's patches? These Peyer's patches are small lymphoid organs which produces antibodies which give active immunization, a passive immunization on the intestinal mucosa. So that Peyer's patches itself will be necrosed. So there is no question of Peyer's patches working. Diagnosis primarily it is from the anamnesis and clinical signs. Anamnesis, the history should be taken clearly because whenever, see, we all know how to deal with the parvo. Whenever there is a parvo, see, I will be particularly, all of us will be very much worried when a parvoviral enteritis case comes. When a pup is present, immediately doctor it is vomiting and having diarrhea. We will be too much worried. We will be immediately thinking that it will be parvo and keeping it inside our clinic. It is hazardous, highly contagious disease. We have to completely disinfect the whole room, the table and all the premises. And when it is being carried, everything will be dropping, the feces and everything will be dropping on the floor. All this will be contaminated. Everything should be disinfected well. It will be a very hazardous time for us. And so the history makes the first thing. The anamnesis we have to inquire. See, please don't. We have to clearly say that please don't enter our clinic. And these are the problems. Like, please don't enter my clinic because it may be parvo, it may be hazardous to other pets. See, I will take you to another room and you assign one staff. You take them to the infectious disease room. Okay, from there it will be taken and the client can come and let us keep the distance from the client and ask him whether your puppy is vaccinated. No. How old is he? 4 months. Whether the dam is vaccinated? No. So how it started? It was having fever yesterday, then suddenly it started vomiting. Now diarrhea is also there, and the diarrhea is having an offensive smell. Okay. And so assign somebody, you go there, you give all the seeds. It is parvoviral enteritis. You don't disturb me because I'll give all the treatments and everything. I will assign one staff to you and he or she will come to you. They will attend your pet and necessary intravenous fluids, etc. will be given to your pet, antibiotics and everything. But don't think that you will get a complete cure because it is a very dangerous disease and we can only just try to save your pet. So take an anticipatory meal and start your treatment. So this is a clinical examination and then the clinical science. Then the CBC, from the clinical science itself, the first clinical sign, as I said earlier, will be retching and vomiting. And that will be highly prostrated, dehydrated, very weak, and you cannot even stand up or walk. Sometimes it will be staggering walk, having staggering walk. So everything will be there. It will be very weak generally. So conduct a CBC. So during the first day itself, there will be you cannot expect a classical CBC finding like leukocytosis. But during the first 2 days, especially the first day, there will be a neutropenia, there will be a leukocytopenia, and sometimes due to a bone marrow suppression, this neutropenia and leukocytopenia will be too dangerously low. So coming around 2500, 2000, 1500 uh, cells per cubic millimeter. That is too dangerous. We will have to either supply IV blood, or sometimes we can supply some, inject some granulocyte increasing colony stimulating factors such as filgrastim along with other treatments. The treatment is coming, and so the CBC, then there will be elevation of ALT level, AST level, alkaline phosphatase, amylase, etc. Everything will be elevated due to multi-organ disorders. Then we can diagnose from fluorescent antibody test. PCR is the best. So nowadays we are only using PCR for the accurate diagnosis. But even otherwise also we can diagnose it from the clinical science and history. It is very easy to diagnose. Parvo we never miss it. Then lateral flow kits are available. We can have also a lot of kits are available. We can immediately on the table itself we can take smear from the fecal smear and we can triturate in the material which is given the fluid or the dilute which is given from the dilute. We can take 1 or 2 drops of the fluid and we can drop it onto the slide and we can wait for the lateral flow. By lateral flow we can see 2 lines. If it is 2 lines, it is positive. 1 line over the control only, we can say it is negative. So all these things you know very well. So that is regarding the diagnosis, and almost in 50% of the conditions, it looks like Paro. There will be vomiting, there will be retching, there will be vomiting, there will be bloody diarrhea, or there may be watery diarrhea. But the thing is that there won't be any fetid odor of the loose stools. There won't be any fetid odor. So we cannot say it is parvovirus enteritis. In such cases also, you should have to check the the species. First of all, confirm that it is not parvo. It will be negative sometimes. If it is negative, then take another swab, then test it for hookworms. Otherwise, also there are say lot of hemorrhagic gastroenteritis or gastroenteritis due to other viral gastroenteritis like coronavirus enteritis. Then protozoal gastroenteritis like Bacterium coli, Entamoeba coli, then Giardia, all these things, bacterial like Salmonella are there. So differential diagnosis should be there. Then immunological like eosinophilic gastroenteritis, non-parvo hemorrhagic gastroenteritis, severe hookworms, Ankylostomes canis, that itself can produce blood in stools. We call it as hematochezia or melena. So if no highly offensive fetid odorous stools, it is better to conduct a detailed microscopic examination of stools to look out for the hookworms. Then how will we manage? For that, we have to study about which are the events occurring in the patient. Number one is dehydration. Dehydration. It is a very dangerous event which is occurring. Dehydration slowly progresses, but not so slowly. It will quickly, I should say, quickly progresses. So we should have to undertake. I have seen one case of a parvovirus enteritis where just injection of antibiotic was given. See how unethical it is. And so it is better to know about the events happening in the patient. Dehydration, shock and hypotension. All these are very acute clinical findings where you have to act all on a sudden to avoid death of the patient because death can happen anytime. Hypokalemia, this is another very dangerous situation. Hypoglycemia always occur. There will be high depletion of blood glucose level to be completely depleted. Sometimes the blood glucose level goes even as low as 20 milligram per deciliter. I've seen case with the 20 milligram per deciliter puppies. Hypokalemia is very often seen vomiting and diarrhea, bicarbonates and hydrogen ions, chloride ions, bicarbonates, and potassium are lost. And hypernatremia occurs at first, followed by hyponatremia. There will be due to spasms of the intestine, there will be enteric spasms. Due to these spasms, too much of pain will be there. You can go for visceral analgesics like buprenorphine. Then sepsis. There will be secondary bacterial growth inside the intestinal villi, and especially in this anaerobic conditions, and toxins will be developed, and due to these toxins there will be endotoxemia, and due to this toxemia, sometimes multi-organ failure also can happen, like kidney failure, acute kidney injury. So these are the events which are occurring in a patient with parvoviral enteritis. Always in such a patient, apply and fix an IV cannula at first. Sometimes you may get exhausted because the vein will be too much collapsed due to hypotension. Raise the vein. You may raise the vein. If it is a small puppy, you can raise the vein, or you can go for the jugular vein, or even you can go for the intraosseous route. Or if you are not able to get any vein or the intraosseous route, then at least you go for the intraperitoneal route. At least 50% of the fluid will be absorbed. But the best is the IV fluid therapy. Second comes the intraosseous fluid therapy. I am coming to it. Then the fluid therapy. In the fluid therapy, always, there will be severe hypotension. There will be severe hypovolemia. And there will be invariably there will be anemia. There will be hypoproteinemia. There will be hypokalemia. So in such a condition, always it is in shock only. In shock, what should be the line of approach? Or going to shock, what should be the line of approach? Go for colloids first. In parvoviral enteritis also go for colloids, especially hetastarch, hexaethyl starch. Colloids at 5 mg per kg, 5 ml per kg, IV daily. So this daily should be seen. There is a mistake in daily, because if you give it daily, there will be accumulation of this colloids. Actually, it has been seen that when these colloids are being given daily, what will happen is that colloids, they will remain in the system for almost 7 days. This was an old slide, that is why it is still there. And now the recent concept is that colloids, once given, it should not be given daily, because once colloid is administered at 5 ml per kg, suppose it is a 10 kg weighing dog, and you are giving intravenously 50 ml of the fluid, the colloid, these colloids will be there and the particles will be there intact for almost 7 days. So if you are giving it daily, accumulation occurs and will add to the hypervolemia. So it is better you give it once only. So colloids at 5 ml per kg followed by crystalloids. Always when you give a colloid, it should be accompanied by a crystalloids, especially ringer's lactate. Why we are using ringer's lactate? Because there are so many advantages. Number one, it's a crystalloid. Number two is it is an isotonic fluid. Number three, it contains potassium chloride, so it can be acting good against hypokalemia. Number four, it contains sodium lactate. Sodium lactate will be converted to sodium bicarbonate in the liver, and this sodium bicarbonate will increase the pH. In every parvo case, there will be metabolic acidosis, and so an alkalinizing fluid should be given. So a ringer's lactate is such a fluid which alkalinizes, so it is can be used against metabolic acidosis, followed by 10% dextrose. Why we are using 10% dextrose? Because hypoglycemia always occur, especially in puppies below 4 months of age. Check the serum potassium and blood sugar. If there is hypokalemia, there is severe hypokalemia, then RL itself will not be sufficient to combat or to act against or to compensate the potassium in the blood. So we will have to add potassium chloride solution into the Ringer's lactate. So potassium chloride solution can be added according to the body weight, 15 milliequivalent per liter or 7.5 milliequivalent per bottle, 500 ml. And then it should be given slowly. Can be given at a dose rate of 1 drop per second. Check the CBC for leukocytes and PCV. Sometimes during the first 2-3 days, there will be leukocytopenia and with the neutrocytopenia. And during that time, we will have to assess what is the level of leukocytopenia. If there is severe leukocytopenia, we will have to go for this colony stimulating factors and check the thrombocytopenia. Okay, there is thrombocytopenia. Let's see, there is a concept. There was a concept like why there is bloody diarrhea in parvoviral enteritis. And everybody thought that, everybody got a concept that parvoviral enteritis, bloody diarrhea is due to the necrotic enteritis. But now it is clear that it is not due to the necrotic enteritis, it is due to the severe immune reactions in the body. There will be a disseminated intravascular coagulopathy and a thrombocytopenia. And due to this thrombocytopenia, there will be bleeding disorders. That is why there is sometimes, I got a case of a parvo in a German Shepherd pup where there was only nasal bleeding, there was only nasal bleeding. So I thought that it was a VBD, and then at last I checked for the parvo, it was positive because later it started vomiting and diarrhea. So nasal bleeding or epistaxis is a clinical sign, can be a clinical sign of parvoviral enteritis due to this thrombocytopenia. And severe hypokalemic can add potassium chloride at 7.5 milligram per milliequivalent per 1 bottle. If potassium is added, administered at a dose rate of 1 drop per second, because if you go beyond 1 drop per second, cardiac arrest can happen. Oral and injectable styptics are useless. I have seen a lot of doctors using styptic, ethamsulate, adrenochrome, etc. Vitamin K, I saw it several times. Vitamin K. Why we are giving vitamin K? There is no depletion of vitamin K. And adrenochrome, styptic like adrenochrome or ethamsulate will not work in parvo. And the fluid therapy. Fluid therapy in parvoviral enteritis. Assess the dehydration for the skin tense. Okay, we are not doing it regularly and blood works. Then we high PCV, hematocrit, then there will be high total solids or the proteins, etc. First, secure and decide IV cannula, since we may have to administer IV fluids twice or thrice daily. So always fix an IV cannula. Then mere crystalloids alone may induce more fluidity and purging. If you are simply giving oral itself, that is not a good treatment. Without a colloid, treatment is not complete, and so you should give colloids first and follow at 5 ml per kg and then followed by a crystalloid. Or oral alone means the fluidity inside the intestine increases because of lot of loss of fluids into the intestinal lumen, and the fluidity of the intestinal contents increases, and there will be purging on the table itself. So I have seen that when colloids are used, the pup or the dog will start eating from the next day itself. And better start with colloids. Get us started. 5 ml per kg IV should be at 2 drops per second. Always beware that colloids, it is a hypertonic solution. It's not a hypertonic fluid. It's not a solution. It's a suspension. It's a colloid. And should be given at 2 drops per second speed. Speed should be very low. Followed by should be followed by the slide at 60 ml per kg IV, followed by 10% dextrose. Or even reverse lactate and dextrose can be mixed together and be given. Check the serum potassium level and add potassium chloride if necessary. If the patient is having severe vascular collapse and difficult to get away, drill the femoral retrocandric fossa into the marrow for intraosseous fluid therapy and never subcutaneous. Why we should not use subcutaneous? Go for intraosseous route. I am going to show you the slide how to use this intraosseous. Why we should not go for subcutaneous? Because there will be peripheral circulatory failure, and during this, there will be, that is why the extremities and the skin, everything will be cold in nature. Circulation will be extremely low, and if you deposit the fluid underneath the skin, it will be there for days itself, won't be absorbed. Undertake fluid therapy once, twice, or three times a day according to the severity of the condition. CBC should be conducted every day before fluid therapy, because always beware of leukocytopenia. If the dog is having leukocytopenia and if it is going below 2500 cells per cubic millimeter, it will die. And so we should have to take all measures to increase the leukocyte count. So if the patient is weak, consider administration of IV fluids and antibiotics twice or thrice daily. And pancytopenia can occur where leukocytopenia can be managed by colony stimulating factor injection, that is filgrastim. Filgrastim is available as 150 microgram and 300 microgram vials. I'll show you the picture. 10 microgram per kg subcutaneous once daily for 3 or 4 days. That is undertaken all the time with me whenever I am dealing with parvo. Then thrombocytopenia doesn't need any specific treatment. See, we have treatment against thrombocytopenia. There is injection known as romiplastim. Romiplastim is very expensive. It can be injected to raise the platelet count, but it is not needed here. While you give the treatment, if the treatment is going on, it is a positive treatment, definitely thrombocyte count will slowly increase. Never use corticosteroids. And thrombocytopenia doesn't need a specific treatment, but will be solved by management of the underlying disease. Bleeding disorders such as epistaxis, hematochezia, hematuria, etc. Sometimes I have got a case of a pup 6 months old which is having hematuria and it was having parvo. Who will think that the hematuria case was parvo? Yes. During when I started the antibiotic therapy, it started purging with bad smell. And so I tested for parvo, it was positive. So I did the treatment against parvo, it escaped. So bleeding disorders, etc. can be seen during this thrombocytopenia. And against the pain, visceral pain can be managed by injection of buprenorphine at 10 to 30 microgram per kg IV or IM for spasmodic pain. And the corticosteroid should never be used. That's very important. Corticosteroid should not be used in parvo as well as in distemper. It will aggravate the condition. Antibiotics, especially enrofloxacin, it is a best fluoroquinolone, a megaspectrum fluoroquinolone at dose rate of 5 to 7.5 milligram per kg. If needed, we can go for 7.5 milligram per kg, or ceftriaxone tazobactam at 25 milligram per kg, or metronidazole at 20 milligram per kg, aminoglycosides, gentamicin like 4 milligram per kg, 5 milligram per kg, amikacin also 4 or 5 milligram. These are aminoglycosides, but generally, previously aminoglycosides were used, but we know it is highly nephrotoxic. So nowadays we can go for, it is better, you can go for enrofloxacin or ceftriaxone tazobactam. Those are better. Then proton inhibitors such as pantoprazole, aripiprazole is necessary. Antiemetics such as ondansetron, metoclopramide, phenothiazine derivatives. And here, according to Merck Veterinary Manual, the best antiemetic in parvoviral enteritis will be ondansetron only, not metoclopramide. Ondansetron is more active than metoclopramide as an antiemetic in parvoviral enteritis. Or we can go for central antiemetics like phenothiazine derivatives. Those are dopamine antagonists. All these three. Then antiviral antibiotics like oseltamivir can be used as an injection, oral suspension, or tablet. I have never used it because I am not so confident in this. Then immunoglobulin tablets, of course, immunoglobulin injection, everything can be used, especially in pups. Immunoglobulin injection is very useful. I am coming through the details of immunoglobulin injection tablet. Good enteral nutritional therapy. See, if when we think that the gut flora is slightly managed or recouped, and it is not eating anything, but it is dull and depressed, even we can go for a pharyngeostomy, and we can go for recovery diets as an enteral route. Then deworming the puppy properly, stool examination, because heavy lot of hookworms itself, they give parvoviral enteritis, and they have a high tendency to develop parvoviral enteritis. Stool examination, proper immunization, good management. Puppies should not be too much crowded. Crowded puppies itself is a cause for this parvoviral enteritis. Don't take out any pup to the public before complete vaccination, which I told earlier. Don't allow anybody, especially children, to come nearby to the puppies or carry and pamper it. Because that is a common tendency for, especially children, they will carry and pamper it all the time. Before that, they will be touching a parvovirus enteritis dog and coming. So, these children and visitors can transmit the disease. This is injection, is an antibody injection. It is a suspension for the injection, heterologous immunoglobulins for dogs. And it is a liquid suspension of purified hyperimmune immunoglobulins to ensure passive immunization. This is passive immunization of dogs against parvovirus enteritis for therapeutic and prophylactic. It is 1 ml vial. We regularly use it. The dose is 0.4 ml per kg body weight of an animal, irrespective of breed, age, and sex. The product can be administered intravenously. IM or subcutaneously. Better go for IM injection. Then therapeutic dose is 0.4 ml of the product per kg body weight until the improvement of health status. It may be used in all animals. And the prophylactic dose also can be used if prophylactic is used when we have a litter of puppies and one puppy is having parvovirus enteritis and the other puppies are asymptomatic. We can give this immunoglobulin injection for other puppies as a prophylaxis. It can be given at 4.4 ml per kg body weight, given at 5 days interval, which can be used even in exposure. This is a filgrastim injection, 300 microgram. The dose is 10 microgram per kg subcutaneously, continuously for 3 or 4 days. I am regularly using this wonderful drug, which can raise the leukocyte count. Otherwise, it will die if it is going below 2,500 cells per cubic millimeter. Canned globulin is very expensive, but we can use it 0.4 ml per kg subcutaneous or IM or IV. And even immunoglobulin tablets are available. We have a lot of tablets are available in the field. You can give for small puppies. It contains 7 tablets and 1 tablet per day up to 7 days. So these parvovirus tablets can be used even as a prophylaxis and as well as a treatment also. You can use parvovirus tablets. Then maternal antibodies will be there as a passive immunity for 2 months in the puppies. So we are having modified live virus vaccines. Immunization 10 days before whelp gives better passive immunity. So we always should advise the pet owner or the client or the pet parent, if we need a passive immunity for the puppies, better give another new shot of MLV and the combo injection or a parvo distemper injection 10 days before the whelp. So that active immunity is, because immune bodies, antibodies will be produced 48 hours, and the antibodies, a slight increase will be there, and the excess antibodies will be passing through the colostrum. It gets the maternal antibodies. Allowed to consume colostrum to the maximum days for the pets. That is what we should advise to the pets. Otherwise, in under-suckling pets, they will definitely get the disease because they don't have this maternal antibodies. Then vaccination. Vaccination regarding parvovirus enteritis. It is the first vaccinate 6 weeks of age. I already mentioned after deworming only, we proper deworming. What should be the proper dewormer? The best dewormer for the puppy is nothing but fenbendazole. Fenbendazole suspension or the tablet, fenbendazole at 50 milligram per kg body weight continuously for 5 days, 3 to 5 days. That should be our deworming schedule. And deworm like this with the fenbendazole 100 milligram per ml suspension is available. or 150 milligram tablets are available, 600 milligram tablets are available, 1000 milligram tablets are available. So all these make available all these things and properly deworm your pet, your puppy as early as possible, as 20 days of age, continuously for 3 to 5 days, and then vaccinated as early as 6 weeks of age, then the first booster at 9 weeks of age, second booster at 12 weeks of age, then annual repetition. This is a schedule given by the Indian Veterinary Association. We can go through it, or even a third booster can be given at the 15 weeks of age. We can use a polyvalent multi-component vaccine, or we can use for a monovalent distemper parvo vaccine. That is according to your choice. And with this, my dear friends, I am winding up our session of parvovirus enteritis. Hope this was a very nice eye opener for you. And in case you have any doubt, definitely don't feel bad. Always feel free to contact me at any time. And Bharat Mata Ki Jai! Long live our nation, our motherland. So thank you very much.